Over the years, yellow fever has been better controlled than it was in the past, largely due to the availability of a vaccine to protect against it. Yet, the World Health Organization estimates that approximately 84,000 to 170,000 people become infected with yellow fever each year. It is believed that many cases are not detected, so the full extent of the disease's impact is not known, and it kills between 29,000 to 78,000 people worldwide every year. Well, with this information in mind, let me say a very good evening to you and thanks for joining us on NCDC Situation Room. My name is Abdul Fattah Otori, and today we focus on yellow fever. Thank you very much for joining us again on NCDC Situation Room today. As we mentioned earlier, today we'll be speaking on yellow fever. As we also told you last week, there were suspected cases of yellow fever reported in Edo State, and that led to the deployment of a national rapid response team to ensure containment of the outbreak. How far has the response team been able to contain this in Edo State and environ? Well, I have with me the team lead of the response and director, Health, Emergency Preparedness and Response for the NCDC, Dr. John Oladejo. But before we get to speak with him, let's take a message from our drama team. After that, we'll make a quick stop at your community to harvest opinions of the people on yellow fever and find out if they participated in the yellow fever vaccination that was just concluded. If I were you, I'll stay right here.
So my mother was actually right when she said beware of a smallish woman. Obìnrin tí ó ga, if she's not a herbalist, then she must be a prophetess. Yami, my mother.
Chibadisa. Wanda na magana ni haka. You ga ikon Allah.
What is that?
What are you insinuating? That my wife is a short woman and so therefore she's a herbalist and prophet. Saboda Allah wanda irin magana ne haka.
Malam Usman. I am not referring to your wife now.
Okay, stop, just stop there. Look, I will not take any insult from anybody on my dear wife, Aminatu. How dare you say because my wife is short, then she is a prophetess? That is even better. Now you are calling her a witch.
Usman, Malam Usman. You are getting it all wrong. She kini now. Can you please just listen to me for a second?
I've listened for more than how many minutes?
You see, this is just a misunderstanding. I was not in any way referring to your wife, Malam Usman. The quote from my mother is nothing but a metaphoric expression that small elements can, more often than not, cause monumental havoc. And one should not look down on them.
So how do you mean? Because you are confusing me.
You see, I read in some research works that lions kill 500 people in a year.
Of course, Mona. Now you know, lions are deadly wild animals. Anytime I see lion, even on television or inside zoo, I just run away by myself. Yes! Kai, one does not play with lion at all. I don't want to die. Even if it's a cartoon.
Tony, you are very right. Now, listen to me. Another research book says that over 5,000 people died of snake bites in a year.
Kai, how can that be? Are they playing with snakes? Don't they know the difference between rope and snake? So that at least they go run away or they can change their mind from staying there.
Malam Usman, you know the real problem. In this our country alone, 300,000 children die annually of malaria caused by an ordinary mosquito bite.
What did you say? 300,000? Kai, why? Look, how can that be? Kai, Anya, are you sure? Small mosquito kill more than lion? It's not. I wonder it's not possible.
What is happening here, Chief Adisa? What is happening to Malam Usman? Because somebody should talk to me now. What is the matter?
How can you just come here and be asking what is the matter when small mosquito can kill far more than very big and dangerous animals like lion and crocodile? See, you are a doctor, ko?
Yes.
How do you explain that a common small mosquito will kill 300,000 children yearly in this our community? Small snake kill 5,000. Even self lion, as big as it is, it kill 500. How? How? One ni abun ya daburce min kai.
Malam.
Na'am.
That is one of the ironies of life. Sometimes the smaller they are, the more dangerous it is.
True. Gaskiya, this is very dangerous. In fact, this is the most dangerous things, doctor.
The truth is that mosquitoes are capable of more dangerous things against humans. Have you heard of yellow fever?
Yellow fever. Yes. You mentioned it the last time you were here. Is it not that the one you said is affecting some communities around Edo and some other areas?
Exactly.
Nothing.
In fact, doctor, even me, I have heard about it. You will see the eye of the victim turning yellow, even the body.
Exactly. And it is contracted through mosquito bite. It comes in from the bush, bites and deposits the virus in the human body. See, it affects more those who work in the plantation, like banana plantations, and those who work in the farms, especially waterlogged areas. When the mosquito bites, it transfers the virus. So from there, person-to-person spread can occur.
Dr. Chuku, Gaskiya, I'm very afraid. I'm very. What do I do to avoid contracting yellow fever now?
Oh, very simple, Malam Usman. Very simple. Clean your environment. And anytime you feel unwell, go to the hospital for a test and treatment early enough. Another thing, avoid self-medication. And above all, report any suspected case of yellow fever to the hospital.
Shogbo Usman, don't treat yourself in the house. Go to hospital.
Why are you telling me?
I know you.
Yellow fever is a type of disease normally caused by a type of malaria. Once it enters into your body, symptoms like yellow eyes, yellow skin, and most especially fever, high temperature do occur.
What I know about yellow fever is a new sickness that government are trying to help the less privileged.
Yellow fever is a common disease here in Nigeria. It infects both young and old in Nigeria. That's all I can say about it. It's just a disease.
When you notice someone that has a yellow eye, there is the effect of yellow fever, and it is very dangerous to our health.
Of recent, they vaccinate all the citizens, which I also received. With this, I think the government are trying.
I was vaccinated.
Yeah, I have been vaccinated for yellow fever.
Ordinary Nigeria, we are in a hurry. Nobody want to even know whether anything is happening. But this yellow fever now, I saw them. They come to the church, they come to the mosque, they come to the school. Even when I'm staying, they come there. So in that area, they try. Because they'll give us a vaccination. If they do not come for this vaccination now, maybe in some years to come, something might be happen. But we don't know. But for them to discover this now, and then come out with this injection and everybody is taking it now, at least in that area, we'll give them at least 80%.
The program is NCDC Situation Room, and today we're looking at strategies in place to combat outbreaks of Lassa fever. Be part of the discussion. Talk to us via Twitter. The handle is @NCDCGov. On Facebook, it's Nigeria CDC. You can also reach us through a toll-free line, meaning you don't get to pay when you call 0800 9700 0010. Send a message only to 0809 955 5577. 0809 955 5577. Text message only. We're also on WhatsApp. You can use the number 0708 711 0839. Alright, now it's time to speak with my guest on today's edition of NCDC Situation Room, Dr. John Oladejo, Director, Health Emergency Preparedness and Response for the NCDC. Thank you so much for joining us on Situation Room today. Now, Dr. Oladejo, we've been hearing about yellow fever for years now. Yet, very little is known about it among the communities where this disease is endemic. They don't know its cause or what to do to protect themselves. Now, tell us, what do we need to know about yellow fever?
Yellow is a name given to that particular fever that makes the eye to be yellow. When somebody has yellow fever, you don't need to ask anybody. You will see the eyes very yellow, and they will say, oh, this person has yellow fever. So, it derives its name from the color of the eye, and sometimes even the skin. The skin will just be yellow. Having said that, it's caused by a virus that's actually found in the special mosquito that is always in the bush. It's a species of Egypt's mosquito that causes this disease. The point is that that particular mosquito has the virus, And this virus, when it bites anybody, injects that virus into the bloodstream of that person, and then the person now have the fever. And if that mosquito again suck the blood of the infected person, it can equally bite another person, and it continues like that.
Hold on a second, Doc. You said it's a species of mosquitoes that spread it, but what type of mosquito exactly could that be?
The mosquito is called Egyptes. It's a special kind of mosquito that you find in the bush. Those days it follows the hunters back into the house. When the hunters go into the bush, we have different kind of mosquitoes, and that particular kind of mosquito has a special features that bite, and sometimes it follows them to the house and continue to bite other people in the main house, and then people now start having the disease.
So how endemic would you say yellow fever is in Nigeria?
Initially there was a time we had yellow fever vaccination. And when you have vaccination, it confers life immunity. But as you all know, some people that were born after the mass immunization we did more than 10 years ago, they are now coming down with it because of the mosquito that are still very much coming into the town through people that actually work in the bush, like the hunters and all these people that cut wood. They call them the wood traders. So when the mosquito now comes into the town with them, people who are actually less immune, when they are bitten, then they come down with the disease. So presently, we have it in some states, but the major area where we have it most now is Edo State. And that is where I was just coming from. I've been there the last 6 days. I just came back not quite long, just to ensure that we actually put everything in place to ensure that the disease is well managed.
Let me ask, when you say you have put everything in place, what exactly are you referring to?
We first of all set up EOC.
Okay.
When we were going, we went with some materials that they can use to treat the patient, and we gave it to the states. So the states are actually using it to treat patients at a designated center. Then we set up AOC, where we have a state IM. IM means incident manager. And this state IM, we have different pillars. All these pillars were actually appointed who takes care of a particular thematic area. We have different thematic areas. I don't need to go into that, but we have surveillance and epidemiology. And these people are the one that goes into the communities to actually look for the cases.
So tell us some of the communities you have been to.
We have been to many communities. Some of the communities we have been to, Wode. I don't know. I may not be able to pronounce it very well. We have been to Ovia Northwest, Ovia Southwest. We have been to Igor, Orion 1, Oredo, Owan West, Ovia Southwest, Owan East, Igwebien, and Umwode. So we have been to all these places, and we were able to get the cooperation of the community. The head of each of the communities, they are very cooperative. They were able to assist us to be able to search for the cases. All what you need to tell them is that anybody that has yellow eye, that have yellow fever, and then we need to see them. So they were able to bring them out. We were able to take their blood sample and take them to the designated treatment center. So these are the things we are doing. And then we equally go into risk communication aspects. We're able to develop risk communication messages, and then we are able to go to media houses. I told you about ITV, and then radio houses too, to inform the public so that the public will be aware of what is actually happening and how they can get help when they need it. The major thing is that when you have yellow fever, the major thing we used to do is to have reactive vaccination campaign where you give vaccines to people that are at risk. Initially, this was not forthcoming, but I'm happy to inform you that we have now been able to get vaccine. And then out of the 40 local governments that are actually being involved, at least we will be able to vaccinate 13 local governments. And we are starting on the 18th of December and to complete it by the 27th of December. It's festive period, but we still work. We don't say that, this is a festive period, though. No. So we are still working, and we'll continue to work until we make sure that we mitigate all this outbreak, and then we are able to say bye-bye to yellow fever in Edo State. not only in the Edo State, but also in Nigeria.
Some very tongue-twisting names there. But tell us, is yellow fever a threat to life?
Yes. For now, we don't really have a specific drawback. It can be managed. If somebody is having fever, you give the therapy. If somebody is having a headache. But it is good for the person to come to the hospital very early. If the person comes to the hospital very early, they'll be able to diagnose the case and then be able to treat immediately. And that is the major thing we are actually emphasizing on, that people should come to the hospital as early as possible so that they will be treated. It can be treated, but you don't have to come very early. When you now start having bleeding in all the orifices, that is the mouth, the nose, then that person may not be able to survive. But if you come very early before you start having those end-stage symptoms, the person will get treatment and will be okay with it. So this is what we are actually emphasizing anytime we go to the field, anytime we talk about yellow fever in any part of the country.
Now, I do know that Lassa fever, for example, has a season. So also is a cerebral spinal meningitis.
Yeah.
Does yellow fever have a season?
The yellow fever, we don't normally have yellow fever like that. The last time we really had the outbreak was about 10 years back when we have it continuously. But in recent time now, we have cases in Kwara, we have in Kaduna, we have also in FCT here. But the major point was that when this disease come in, the major thing is that we need to intensify campaign. That is the only way we'll be able to get out of it. So the mosquito that actually causes it is Aedes aegypti, because it is a special mosquito that you always find in the bush. But we realize that when we're in Edo State, most people have this banana plantation, and some of it are hidden in those plantations very close to their houses. And that is the reason why they are coming down with the disease.
But yellow fever is one of those diseases preventable by vaccines. I'm also aware that you're not allowed to leave the country without showing evidence that you have been vaccinated. So, how come the outbreaks?
We have yellow fever as part of the API program for the children. But the point was that we have for equally those people that are traveling. But most of the people that are now coming down with the disease, they will tell you that they have never had yellow fever vaccines in their life. Maybe they missed it when they were young, or they have never traveled anywhere to really request for it. So the major thing is that these people, their immunity is low. So anytime they are bitten by Aedes aegypti, an infected mosquito, then they come down with the disease. And that is what is happening. You're supposed to have taken it when they were younger, but they didn't have the opportunity. Maybe the mother was saying that the place is very far or something happened, and they have never traveled before. So they don't have the immunity at all. So when they are exposed to this mosquito, they come back down with disease with immediate effect.
Okay, let's talk about the cases in Edo. From the update, as at last week, we were told that about 43 communities were affected. At the point you were leaving, what was on ground?
At the point I was actually leaving, our team, together with other agencies, WHO, UNICEF, even the state team, they've all formed different groups that were going from one community to the other. I have the pictures of all of them here, only that our viewer will not be able to see. These people, what they do is they go to the community, they sensitize them, they tell them exactly what yellow fever is all about, how it can be transmitted, what they are expected to do. They are expected to wear some form of clothes that will cover them, like long sleeve, and cover their legs too, so that they will not be exposed, and wear shoes. So these are the things they are going about telling them. So they were going from one community to another, and they are covered even more than that now. As at the time they were reporting to us, they have covered all those communities. So what they are now planning to do is to go and vaccinate all those high-risk areas, all those communities that are affected. So our governments have actually provided vaccines for the vaccination of the high-risk population.
So apart from Edo, which other states would you say are at high risk?
For now, some of the states that were affected, they are very silent now. Active case chart is taking place in those states, but we have not been having any new cases from them. So we don't have problem in those places. But where we are really having issues is Edo, and we are on top of the game.
So, the communities, are they cooperating with NCDC?
Yes, I told you that all the places where our team have been to, all the head of communities, the head of each of the clans, they are all cooperating. In fact, they even give them opportunity. They bring all their people to come and get sensitized by, providing a space for them. So we don't have problem in entering any community, in entering any place to ensure that we sensitize the community.
Okay, Doctor, let's talk about protection. What message would you have for the people on protection?
The first thing is that they should be able to sleep under bed net. I told you about mosquito, just like malaria. So everybody should ensure that they have treated nets where they will sleep. And then when they are outside, they should ensure that, or at least they wear clothes that covers them and wear shoes too, to ensure that they are not exposing part of their body. And they should ensure that all the tires that have water, that are litters around, they ensure that they discard all of them. They make sure that the environment is clean. And then they make sure that they eat good food too, so that they can have good immunity. And then ensure that the water they are equally drinking, they have to boil it. So everybody must be on alert to ensure that the environment is key and is clean.
So what about when someone has a fever? Around here, every fever is assumed to be malaria.
Okay, that's what I will say, that if anybody has fever, they should make sure they go to the hospital. Because some people, they would like to go and look for drug on their own. It is not acceptable. They should go to the hospital, because you will be thinking that you have malaria. It may not be malaria. And if you continue to take malaria drug, whereas you have another thing, that disease you have in your body will not be cured. And that one will not getting worse before they are diagnosed. So early diagnosis is very, very key. Apart from the prevention I've just mentioned, then people should go to the hospital. They should allow a qualified health personnel to treat them and then get diagnosed early so that they can be treated. This yellow fever do not kill if you come to the hospital within a very short period of time, because they will be able to take care of you, give you all the necessary treatment, and then you go home. We have several of them that our team were able to say at the communities, and they brought them to the center in Edo State, and they are now back home. It's only those ones that refuse to come to the hospital that get worse that's now had the problem.
So it's important they report to the hospital for treatment, right?
Yeah, it is important because that is where you can get diagnosed and then get treated immediately.
All right. Now, Dr. Oladejo, what other message do you have for the people that I probably haven't asked you yet?
Actually, you have really gone through everything, but I want to make more emphasis on the fact that they must be sleeping under a treated bed net, which I've just mentioned before. And then when they are outside, they should make sure that they cover themselves with good clothing so that they don't expose themselves to mosquitoes. And then they should make the environment clean. There should not be any stagnated water all around where those mosquitoes can breed. And they should ensure that the bush around them are cleared so that they will be living in a healthy environment. So this is very, very key, even not only for yellow fever, for other diseases that are just all around.
We must say a very big thank you to you, Dr. John Oladejo, Director, Health Emergency Preparedness and Response for the NCDC, for speaking with us.
Oh, thank you very much.
Of course, we cannot go without checking on update from week 48 for Lassa. Let's go to the Situation Room where Godwin Odemija is waiting to tell us more. Godwin.
Thank you, Abdul. What we can safely say here is that the yellow fever outbreak is being effectively curtailed. And for Lassa fever, this is week 48. And I have on the line technical team lead, National Lassa Fever Working Group Nigeria, Mrs. Ese Ilori. Madam, you are welcome to the program.
Thank you.
This is week 48. What is the latest on Lassa fever?
Yes, we're in the season. So we're having more states coming in and reporting. Like now we have Kano State coming in and having a confirmed case. Of course, Ondo State is still reporting, and Edo State, Ebonyi has not reported for some time now, but we're still watching. What we're doing right now is to make sure that all the states are well sensitized and then the health workers are also well sensitized to be able to have a high index of suspicion. So the situation right now is we're at the alert mode, and so we're watching, we're prepared, and preparing the health workers and also the people to be at alert.
Okay, with cases now coming from the north, what does this portend?
We've had cases from the north. For example, Kano had reported confirmed cases before in previous years. It's just that early this year they did not report, but they have reported a confirmed case. And Kano is actually well prepared because they have an emergency operations center well established, and so they have a treatment center that can manage the Lassa fever case. So Kano State, the recent report from Kano State has been well managed. Then we also got one from Kaduna State. Kaduna State also has reported confirmed cases of Lassa fever before, so they have trained physicians that can manage the cases. They have also sensitized their health workers in terms of preparedness. So those states that have recorded right now are states that have had confirmed cases of Lassa fever previously. So it's not new to them, so they're able to manage these cases.
Okay, in the previous report, we had cases involving health workers. What is the situation in the current report?
Yes, recently we have recorded infection in health workers for these past few weeks. But the good thing is that they have been managed, and so we've not recorded any deaths in a health worker in the recent time.
Well, generally, what will you say is the level of preparedness in the various states?
Now, the various states, especially those states that have recorded confirmed cases, we train a group of health workers that can easily respond to any case of Lassa fever in the state. And so in terms of preparedness, we have done that. We have also prepositioned supplies to all the states that have been affected this year. And most states also have some providing for treatment, at least for one confirmed case. That is for even those states that have not recorded any confirmed case. So we have prepositioned, we have done a lot of sensitization, and we have also trained the health workers. What we are doing right now is to call the states and remind them of what we have taught them. We have a team also going into the states. We have a team going in Ondo State right now. And also during the week, the CEO will be going to Edo State and Ondo State. Those are the high burden states to do some advocacy. So we are reaching out. We are being proactive so that we're not waiting for the outbreak to start occurring. We are being proactive, prepare the states for the outbreak.
I must thank you, Mrs. Ese Ilori, for speaking with us on the program.
Thank you for having me too.
And that's the size of the program NCDC Situation Room for today. If you want more explanation on what you've heard, or you just want to know about the Center for Disease Control, reach us via Twitter. The handle is @NCDCGov. On Facebook, it's Nigeria CDC. You can also reach us via toll-free line. You don't get to pay when you call 0800 9700 0010. Send message only, do not flash or text to 0809 955 5577. And on WhatsApp, you can find us using the number 0708 711 0839. Thank you very much. The program is a production of Gado Agency Limited under the sponsorship of the Nigeria Center for Disease Control, NCDC. Visit their website to know more about the center. It's www.ncdc.gov.ng. The executive producer is Godwin Odemije. He also wrote the drama story. Mobolaji Ajani is the producer of the program. I'm Abdul Fattah Otori. Let's do this again next Monday. Time is 5:30 p.m. I look forward to meeting you again. Before then, stay safe.